Welcome to the League of Women Voters of Lexington's Community Forum, the Icelandic model for preventing adolescent substance abuse. I am Mary Hughes, co-president of the League of Women Voters of Lexington, and I am here with League co-president Jennifer Jackson. Our speaker tonight is Dr. William Dake, Lexington family medicine physician with HealthFirst of the Bluegrass. Dr. Dake helped start the medical treatment of opioid addiction in his clinic. He advocates for the prevention of substance abuse at the community level. He will explain the implementation and outcomes of this program developed in Iceland. As we said, your questions will be answered at the end of Dr. Dake's presentation. And now we'll turn the program over to Dr. Dake. Welcome.
Well, great. Well, thank you for inviting me. This is an honor, and I'm really appreciative of the work that the League has done over the years. I guess this is you just have or are celebrating your 100th year, which is amazing, and certainly this past election cycle has reminded us the importance of our democracy and that it needs to be protected. And I know that that's what the League is all about. So as a citizen and a voter, I appreciate that. One thing that the League obviously does, they want democracy to be safe, healthy, and strong and successful. And that's really all we want for our kids too. So if I could share my screen. Okay, so I think we are there. If I can, I'm a Zoom naive as far as doing PowerPoint, so bear with me. So this is about the Iceland model. And like I said, we all just want our kids to be safe, healthy, and successful. And I usually try to mention a word about the cocaine epidemic in the 1980s. When we do these presentations, frequently there's some questions about how the country responded to the cocaine epidemic back then. In 1986, there was a law passed that really heavily affected the African American community. And under the law, the African Americans were much more likely to be charged and convicted. And they were given much longer sentences compared to white drug users. And the African American community is justifiably angry about this and understandably suspect when anyone starts talking to them about the explosion of any other drug use just because it's affecting white people. So we don't have the power to go back in time and prevent a wrong that was done over 20 years ago. All we can do is move forward with grace and compassion and reminding adults in all neighborhoods that we all have kids that are at risk for harmful behaviors, whether it's alcohol, tobacco, or other drugs, or truancy, fighting, or crime. And every parent just wants their kids to be safe and healthy. And we hope that anger, no matter how righteous over an injustice that was done yesterday, won't prevent us from protecting our kids tomorrow. So a few years ago, I was worried about the reports we were all hearing about the opioid crisis and the increasing number of deaths from overdoses. And so with the help of some of my coworkers who had some experience in this, we launched medication-assisted treatment for our patients with opioid addiction, basically to serve as a bridge to help keep them alive while they sought therapy to really get to the root causes of what's causing their inability to function without their drug. And as a part of that, we attended several conferences, and on one of these conferences, one of the sessions was led by an American guy named Harvey Milkman, who is a psychologist out of New York and then later in Denver, Colorado. And in his session, he described some of the foundational work that he had done like 30 or 40 years earlier. And then he talked about a prevention program that he developed or helped develop in Iceland. And the results of that program that are just truly astounding. And I've searched high and low, and I've not found a program done on a large scale like this over a long time frame with anything like these same results. And his presentation motivated me to become an advocate for this program here in Lexington. So I've spent the last couple of years talking to as many people as I can. So here I am tonight, hoping that you'll find this interesting and just maybe worth some of your time and effort. So for the scope of the problem, as you probably know, Central Kentucky, particularly Appalachia, is in the crosshairs of the epidemic. And I'm going to try to, not sure what you guys see on your screen. I'm going to shrink everybody down there. So these are the national numbers as recently as 2019 and these are for all drugs, not just opiates. And the preliminary numbers for 2020, the estimate is that instead of 70,000, it's going to be more like 87,000 this year. And if you go back 20 years, it totals up to be about 500,000 people. So that's basically the, roughly the same number of people we've lost to the coronavirus spread out over 20 years. So the numbers are really just astounding. And there we go. And let me shrink me down again here. And then here are the numbers just for Kentucky over the last 5 years. And you can see that there was a significant spike beginning in the spring of last year. And again, the final numbers for Kentucky are not in yet, but they're expecting our number to come in at 2,000 people for all of 2020. And just put that in perspective, a year ago, we were at 1,300. So that's like a 50% increase. Lexington's number of deaths a year earlier was 128, and we've jumped up to 209. So we've gone up just in Fayette County more than 60%. And Lexington has a per capita death rate that's more than double the national average right now. So things have really gotten bad. One thing that one of my partners predicted when the coronavirus epidemic hit was when non-essential services were being shut down and drug treatment programs were being scaled way back to just bare bones therapy. And so the patients who were already enrolled and engaged in any kind of drug rehab program, their support services shrank to, basically non-existent levels. And my coworkers knew that the overdose death rates were going to go higher. And unfortunately, that panned out. So you see sort of in the middle of this whole bar graph was a marker for March of last year when the safe at home orders were put in place. And then, less than 2 months later, we had a huge spike in the number of deaths. So sadly, that was all predicted or predictable. And then here just the county maps for Kentucky going back to 2017. Fayette County was sort of a cooler cream color, and now we've ramped up to more of a warm orange color. But if you'll see that rim of counties to the east and the south, that they are just literally on fire right now. My son goes to school down in Richmond at Eastern, and he works part-time for the Madison County EMS, and he says the huge majority of their runs are related to overdoses. So they're really being swamped down there. So that's just sort of a tally of the human costs, but there's also a lot of economic costs associated with this. So that if you run a business or if you manage a budget, you may want to go get some Rolaids, because the next few slides are pretty bad. So in Fayette County, they made just over 2,000 runs for overdoses in 2018, and that comes in at about $475 for each run. And you multiply that out, and that's $1 million a year. 2 years ago, 3 years ago, when the overdoses were even a little smaller, and that's just to get the patient to the emergency room. And then some of the larger scale costs that have been sort of extrapolated out for Fayette County. We have a column for the direct costs, which is all the medical care, both inpatient and outpatient, drug rehab costs, and then we have the court costs and corrections in there as well. And then we also have the indirect costs, which is primarily when somebody dies young, they calculate the loss of income and spending potential and productivity. And then a third column totaling those up. And then we have the opiate costs, and there's just a huge number here for the indirect costs, because this illness kills people so young and they lose decades worth of work and income and spending. And that came from the White House Council of Economic Advisors. And then these are extrapolated numbers for alcohol and tobacco. And so if you total that up, and again, this is like a compilation of 2015, 2017 numbers, so it may be worse now, but that comes in at just over $1 billion just for Fayette County. And to put it in comparison to what our financial output is, we have an economy that's worth about $26 billion. And so we're losing almost 4% of our economy just right off the top, just with drug use and overdoses and all the illnesses that spring from all those various sources. Okay, so before we get into the model itself, it helps to talk a little bit about what's happening in the lives of our young folks and in our brains when we're exposed to drugs. So this is just a little bar graph showing that most people, if they develop a serious drug habit as a young adult, they started when they were kids, younger than age 18. These are people who wound up being admitted to an inpatient treatment facility, and they basically just told the researchers there when they started using drugs. And for 3/4 of them, it was before they turned 18. And then here's just a breakdown of the drugs that those same people were using as they initiated. For most people, it was alcohol and marijuana, but even at young ages, a substantial number of people were using heroin and then winding up in a treatment program. And this is just for 12th graders, some of the various substances that they've used over the last several years. Thankfully, we're seeing cigarette use going down, but just in the last few years, you see those two lines spiking up for the kids who are vaping nicotine and vaping marijuana. I think I saw a recent report where the vaping of nicotine may be beginning to level off some, so we can hope. But I know when my kids were finishing high school, vaping was just all over the place. So as far as why they're experimenting with drugs to begin with, and this is not an all-inclusive list, but this is a pretty good sampling of some of the reasons kids give as they're tinkering with drugs the first time. So it can be kind of boiled down to, I'm curious, my friends are doing it, I'm stressed out, I'm bored, it looks cool, and the way I look at it is they're just simply not content. And of course, teenage discontent is nothing new. It has been present for a long time. So the real question is how do we get our kids to a reasonable place of contentment so that they don't feel the need to experiment with drugs in the first place? So if you'll bear with me, I've got just a few minutes of some brain chemistry that Dr. Milkman talked some about, and I found it to be very compelling. And so I hope it's not too nerdy of a thing for people to be interested in. So this is just a cartoon of a Skinner box, what you might have learned about in psychology class. But basically you put a rat in the cage, there's a lever in the cage, and in this case, the rat is hooked up to an IV that has, say, cocaine or some other addictive substance. And when the rat pushes the lever, it gets a dose of the drug. And if it's a really addictive drug, the rat will push the lever more and more, and it might not stop to eat, it might not drink, it just keeps on pushing the lever. And they did a second experiment where they actually put a small electrode in the rat's brain near one of the pleasure centers in the brain and hooked the electrode up to the lever. And it was the same deal where the rat could push the lever and the electrode would get energized and it would feel good to the rat. So the rat would keep pushing the lever and it might not stop to eat, it might not stop to drink, but it just keeps on pushing the lever, just like the rat on cocaine. So the first big takeaway is that you don't have to have a drug to get a drug-like effect. So some of the early neurochemistry, the discovery of dopamine was a major turning point in the understanding of addiction. And when a lab animal was given addictive drugs, dopamine was being released in the brain. And they also found out that electrical stimulation of the brain also causes a dopamine release. So the second big takeaway is that dopamine is the central actor here. All these drugs that people take, they don't by themselves affect the brain directly. They just merely serve as triggers for the release of dopamine, which is the main chemical that generates pleasure. So Dr. Milkman, we talked about earlier, and he made a series of 3 important hypotheses several years ago related to the behavioral aspects of addiction, not just the drug or pharmaceutical effects. So his first thought was that if someone has a drug addiction and that addiction is mediated by dopamine, then maybe a person addicted to a behavior, say somebody who has a gambling addiction, maybe that is also mediated by dopamine. And then he thought that maybe normal, enjoyable activities also cause some amount of dopamine release. And 2 decades later, both of these theories were confirmed by further studies. And I know we've all heard that, if you hug your spouse or pet your dog, you get a little dopamine release. And that's what this is all about. And his third hypothesis is that maybe if you give troubled kids healthy activities, maybe they would get enough of a dopamine release that they could avoid some of their risky behavior. So he got a grant while he was in Denver, and he set up a program where basically he took teenagers who were already in trouble, either at school or with drugs or with the police, and then offered them alternatives in art, music, dance, athletics, anything they wanted to learn. And the key there is that these are things that the kid was already interested in, not something that a grown-up said, here, this will be a good idea for you. So it's something the kid was already enthusiastic about. And then basically he gave them really intensive, high-quality experiences in those areas. And they also got some coping skills and life skills training. And he was able to show that his group of kids showed a decreased trouble at home, less drug use, and were better able to withstand negative peer pressure compared to a control group getting the usual care in the state school reform system. So he thought he was onto something. And so he concluded that you don't need a drug or even an electrode in the brain to get a drug-like effect, to feel content. Healthy, stimulating, fun activities will do. So on to Iceland. So Iceland has a population of about 350,000, so just a little bit bigger than Fayette County. And prior to the 1980s, it did not allow beer sales. And then in the mid 80s, they changed the law and they had what they call Beer Day, which they still celebrate now every March. And they started making up for lost time, especially the teenagers. So this is downtown Reykjavik in the summer at 3 a.m. And call me old-fashioned, but if you have this many kids together at 3 a.m, even if the sun is out, probably not much good is happening there. And the folks in Iceland knew it too. And so they were very highly motivated to try to find a solution. So Dr. Milkman happened to be in Iceland lecturing on his program from back in Denver. And the local folks there were very interested in helping their kids who were already having trouble, but they took it a step further and wondered that if some of his principles could be applied to the entire youth population. So they talked about it and worked on it for many months. They got buy-in from the highest levels of government. And then they spent more time designing an intervention program. And then in 1999, Youth in Iceland was launched. And so at the government level, they changed laws that made it much more difficult for kids to buy alcohol and tobacco. They essentially banned outdoor advertising for tobacco and alcohol. And over the last 10 years or so, there's ample research to show there's a direct connection between teens initiating use and their exposure to advertising. And they also set curfews for the kids because they decided that kids out at 3 a.m. is maybe not such a great thing. And then they also started after-school activities, and they succeeded in basically making it the norm for kids to participate in after-school activities. It's kind of weird if a kid does not. And these are things that the kid is interested in, whether it's art or music or soccer. And they basically had activity cards or debit cards to help families pay for these activities. And a lot of the families that are financially comfortable, they foot their own bill. And this is just sort of going back to what Dr. Milkman had demonstrated, that if you have a kid and you give them just a little bit of extra dopamine in their brain, it can reduce their need to go out and try to find more exciting, higher risk things to do. And you'll notice there was no educational piece for the kids. There was no training about how bad drugs are and that kind of thing. It's basically you give them healthy, fun, high quality activities, and all the education was really reserved for the parents. So they had these school-based education programs for the parenting to think about their parenting style, because I think culturally there may have been a little bit of a thought that, gee, Iceland's a safe country, and that maybe it's okay if the kids want to be out late at night, because probably nothing bad will happen. And so they had the parents start rethinking things like that. And then basically, the other things are just what we would call old-fashioned parenting values, to spend more time with their kids, to talk with their kids about their lives, to always know where their kids are. And these last two things are really important because they've really been borne out in the research, is to know your kids' friends and get acquainted with the friends' parents if possible. And that's called intergenerational closure. And kind of remember that phrase because we'll come back to that in just a little bit. And then the other part of this is keeping their kids home at night, basically to have your own curfew. Obviously, there was a government imposed curfew, but the parents, were encouraged to have expectations that after a certain hour, the kids would be home. And then in Iceland, and I've really not heard of any other communities around the world doing this, but in Iceland, they have parent groups that get out and walk the streets after curfew, looking for kids who are out late when they shouldn't, and encourage them to go home. So all of those things add up to this concept called perceived parental involvement. All those efforts by parents to be connected and take care of their kids. And the name is a little odd because, we could be excused for seeing, a name that's perceived anything. And we might think that, well, gee, maybe that's not really anything substantial at all. But we do have a local example of a perception and how powerful it is. So if you think for a second that you're in your car driving on New Circle Road and you're down near the mall and it's 5 o'clock Friday afternoon, and you're driving, because you're a careful driver, you're driving the speed limit at 55, and just think what that experience would be like. Assuming you're in the right-hand lane as a safe driver, probably a ton of cars would be flying past you a lot faster than 55, and fast enough that you might think the paint's going to come off your car. And now imagine you're on a different road, that you're on that section of US 60 that's between my hometown of Versailles and Frankfurt. And just think to yourself what driving is like on that road. And most people I've talked to say, yeah, people drive different there. And it's a little bit like going from the Daytona Speedway to Amish horse and buggy country in comparison, because people really mind themselves on that stretch of road because there's a perception that it's heavily monitored by the police. And I live in Versailles, so I'm on both roads quite a bit. And I actually see a lot more police out on New Circle Road than I do on the road to Frankfurt. And that might just be my perception, but there is enough of a perception that it's heavily monitored that pretty much everybody drives a lot more slowly there than they might say on New Circle Road. So the perceived parental involvement doesn't mean being a helicopter parent. It just means that you're being aware of what will make your kids a little bit safer and maybe buy them a little bit of luck for being healthy and safe. It doesn't mean you follow your kid around like a private investigator, but it does mean you understand the benefit of being home at a certain hour and limiting their screen time. It doesn't mean you conspire with all the other parents to spy on the kids, but it does mean you take time and interest at least to be acquainted with their friends and their kid and their friends' parents. And even if it superficially embarrasses your kid, which it probably will, at a deeper level, it will reassure them that they are important to you, and not to be the total be all end all of your world, but important nonetheless. And it doesn't matter how involved the parents are. What matters is how much the kids think the parents are involved. So with Iceland, with this how did they do? So here's their baseline numbers. The top line up there, the red line, is for heavy drinking in the last 30 days. And that means more than getting just a little tipsy. That's bad, falling down, hard drunk. And the middle line is for daily smoking. And the purple line at the bottom is for ever tried marijuana. So again, these are the baseline numbers. So well over 40% of kids were getting hard drunk regularly. So after 2 years, the numbers started going down. And then at 4 years, and then at 8 years, and 12, and 16, and 20 years. So when I saw this graph a few years ago, I just about fell out of my seat because I have not seen anything like those results sustained over that long a period of time in a large population. And I have been searching high and low, but have not found anything like that. But a lot of people ask some realistic, real world questions. They wonder what happens if a family can't participate in this, because there's going to be some families that cannot or will not participate in things like this. And they do have studies that have shown that if you have a kid, let's say the family's stressed out, a single parent working 2 jobs, or a common thing here in this community is you've got grandparents raising kids, and they may not be in a situation where they're going to be able to be as engaged with what's happening at school or with a program like this. That kid may not get the same level of parental involvement that everybody else did. But if that child goes to a school where there is a fairly high level of parental involvement, then that child will benefit also. That they've shown that, for instance, experimentation with alcohol is lower for that child than a kid in the same situation at another school where there's significantly less average parental involvement, just sort of in the local environment. And this is particularly true, and this is going back to that phrase we mentioned earlier, if there is intergenerational closure, meaning if the parents are at least acquainted with the other parents, then that has an extra protective effect for the kids. So having said all that, I've made this presentation multiple times, and frequently I talk to somebody who says, well, that's nice, but for the kids I deal with, I'm not seeing drug use and drug addiction as a major worry. They have other things on their mind. I think everybody, if you deal with teenagers, you're worried about something, but it's not always just drugs. So if you're in that camp, if you're not worried about the impact of drugs, then you might care about truancy or bullying and fighting or petty crime and suicide. So these are truancy numbers for Iceland, and it's comparing to an international average in the middle and the United States at the far right. And these are baseline numbers from the year 2000. And 12 years later, all 3 categories, all 3 groups had a drop in their truancy, but Iceland's truancy numbers just fell out through the floor. And so if you or anybody you know is connected with school funding, then they might be interested to see what might lower school absenteeism. And so these are the numbers on bullying. So a substantial drop there. And again, if I know the school system's interested in school safety, I would hope they would be interested in this. And changes in fighting. The top line is a European average, and how since 2005, Iceland has been deviating in a better direction with fighting. And these are measures on theft, and this is for items either worth more than $40 or less than $40. So they sort of covered more expensive and less expensive items, but a decline in all categories there. So several years ago, the program was exported out to other countries in Europe. It's called Youth in Europe. And some of the early data coming back from those communities show that in Lithuania, smoking, drinking, and crime has fallen. And in Bucharest, the suicide rate is dropping. And now it's been rolled out worldwide. It's in 23 countries. And there is a support team in Reykjavik that helps participating communities develop an initial survey to sort of find out what the kids are doing. But each survey is tailored specifically to that community because there's going to be certain things that Reykjavik needs to know that, say, the people in Frankfurt don't need to know about. And then how it works is the communities will take that initial survey and then generate an implementation plan. Again, and it's all driven by the locals. So it's not like the people in Iceland coming in and saying, this is the intervention that you need to do. They're just there to facilitate and support. And then the local leaders go back to their neighborhood communities to serve as champions and to roll out whatever they think is appropriate and doable given their resources. So the communities in the United States, Wasilla, Alaska, I guess that's Sarah Palin's hometown. I don't know that they're an official cooperating community, but I think they've gotten some level of support from the folks in Iceland. So they're doing an intervention there. In Vermont, there's a series of small towns that have signed on and have begun their work. And close by in Frankfort, Kentucky, the local health department and, excuse me, the local ASAP board has partnered with a youth drug prevention program called Yes Arts, and they signed a contract with the folks in Iceland about a year ago, and I think they've just gotten back their initial survey results and they're digesting that and coming up with their intervention plan. I think they have already activated these debit cards for the kids because I think they knew ahead of time that that was something they wanted to do. And I think they've started with a pilot program involving one group of middle school students to just get things started. So, so the group that I'm with is called LexPrevent, and it's a new advocacy group encouraging people to learn about this program. And we're convinced that it's a high quality program, really with results that are without compare that we can see. Your support is welcome. So if you find this interesting, particularly if you think you might be interested in helping, we would love to hear from you. So any questions?
Dr. Dake, it's Mary Hughes.
Yes.
I've actually put something in the chat, but you really answered it when you started talking about how communities start to implement this or can.
Yes.
I think this this new group in Lexington, do you know if the people that are Lisa Higgins Horde, who, was that our mayor selected to lead the effort on the Commission for Racial Justice and Equality, to make sure that those recommendations were actually going somewhere. I know when she talked to us in our a meeting we had last month, she was talking about youth and summer involvement. And of course, when we had Dr. Helm on our women's panel in April, and she also talked about that. So those sound like two groups that really should be aware of this.
Yeah. I actually spoke with, I guess it's Partners for Youth, and I am blocking on the lady's name, the director there, but I guess they sort of serve as a sort of a clearinghouse for some of the youth activities. Because that would, those kinds of groups would be perfect partners for this, because my little group, we're not thinking about running kids activities,
Right.
but if we could coordinate the and enhance the activities for the kids, as far as the scale, and then if we were able to develop a parent education piece that got at least some level of penetration, that we could do some good. That's at least our starting thoughts. But again, we don't have all the key players on board yet. We did present this to the Board of Health like 5 days before COVID hit. And wow. I'm sure they haven't thought of anything other than COVID for more than a year now. And I can't blame them. Last winter, winter a little bit more than a year ago, pre-COVID times, we did present this to the Health and Wellness Committee for the Board of Health. My understanding, it was at least mentioned out loud in front of the board. But again, that was, a matter of not too many months before coronavirus hit. And of course, they lost their superintendent. So they have had a huge amount on their plate. So I myself, this whole thing got put on ice for several months due to the virus as well. But yeah, so, but yeah, certainly Ms. Higgins, through the mayor's office, I need to reach out to her because I've not spoken to her. And then I think the mayor has a new task force leader for the opiate addiction. I guess Andrea James was there previously, and then I guess it's Mr. Karama, if I'm pronouncing his name correctly, is there now. So I need to check in with him at some point as well. But yeah, so basically we're just, like I say, we are a nascent organization. We've got a steering committee. We've got our name reserved with the state, and bylaws that have been edited and ready to approve. But we're working under the thought that what we really need is to work off of personal connections, and basically it's going to come down to folks knowing other people that they already have a personal relationship with, and encouraging them to participate. And then hopefully we will eventually get to where we're actually having serious conversations with the key decision makers through, say, the Board of Health and the school system, because we'll need the backing of those two groups. and for drug-free Lex as well. Which, and I don't know if you do any of y'all have connections with drug-free Lexington, the local ASAP, because as of like a little bit more than a year ago, they did not have a permanent chair, and I'm not sure whether they have gotten themselves staffed up again yet or not. So
I personally don't. I don't know if anybody else listening does.
Yeah, I don't. But there might be somebody within the league that
yeah,
has one.
yeah,
We can ask at our next board meeting or put it in our newsletter.
okay,
Um, yeah. I did have a question about,
yes.
you had mentioned something about the group in Frankfurt, how like the kids are going to get debit cards or
Mhm.
something. Is that for taking art classes, or like what is that like?
Yeah, yeah. I think what they've done is I would have to go back and check their website again, but I think they've actually contracted with several, I guess you could call them vendors, but basically several organizations that were already providing youth activities, both art-related things and athletic-related things, and then basically got them to agree to accept these debit cards as, payment for a kid enrolling, in a soccer class or an art class or whatever it is. And yeah, so and I think they got a grant to help launch this whole thing, but a portion of that was the folks awarding the grant sort of expected that the activity cards would be a piece that would be implemented very early on, even before the first survey came back. So
It sounds wonderful. Do we have more questions? Um, as Jen said, we will write up an article for our newsletter
okay,
about this, because I've been taking notes and hope I can do justice to all this great information you gave us.
yeah,
And then,
and has the PowerPoint been recorded as well?
Yes.
Okay, good.
Yeah.
Good. So what I'll do is I'll just pop up this last screen that just has
Oh,
my
perfect.
contact information on it, just so that if anybody has an interest, they can reach out.
that sounds great.
Yeah, this is really wonderful. I mean, I really think that in our discussions with Lisa Higgins Ford, like she would really be supportive of this type of initiative. There's a lot of concern for, I think, I mean, as with many things, we had like youth voter registration projects that kind of got put on ice because of the coronavirus pandemic. But really, in some ways, because of the coronavirus pandemic, we need this type of community-wide intervention even more than before, because youth have nothing to do, like they're bored. And that's a big problem, and we're starting to see that. So I think this could be kind of a although maybe the timing, I guess, for the rollout initially may not have seemed ideal because everybody was distracted with other things. That maybe really the swing side of that is that this is going to become very pertinent to our community needs.
Yeah. Well, I think just from the costs and just human life, but then just the economic costs. I think there's a lot of compelling reasons for doing it, and the sooner the better. And so we're going to keep whittling away at it, and so keep your ears open for us. We hope to be getting a little traction as the months roll by here.
No, I did have another question, actually. I was looking back at my notes. So, the overdose rate has really gone up. And do you think that's more of an issue of, like, what are the factors playing into that? Whether it's that drugs are now laced with fentanyl, and so dosing becomes
Yeah.
way more of an issue. If
Yeah.
it's that people are now more bored, have nothing else to do, so they're using more,
Yeah.
or also that because people aren't out and about or interacting with other people as much, that somebody who runs into someone who has overdose, they may not have as much availability for Narcan, or opportunities for someone with Narcan to be present when there's somebody that overdoses.
Yeah, yeah. The best I've heard, and I'm going to see if I can find. I think I've got a slide buried here somewhere. Let's see if I can find it. And if it's in here, yeah. So this slide, and slide, yeah. So this slide is just showing the spike in the fentanyl doses, that number that's going almost vertical. So that's been happening for a few years. So that's sort of the background level we're at. And a lot of folks sort of speculate that part of our local issues, just because we're at the junction of I-64 and I-75, and it's just easier for the people making and transporting this stuff to dump it right off the highway. So that's part of the problem. But then one of those previous slides that I showed, particularly for why the last year was bad, the folks that I work with that have a lot of years doing drug addiction work, they totally predicted that the overdose rate was going to go up, primarily just because of the social isolation that everybody was experiencing, and plus that made people more at risk for heavy use. And then plus, if somebody was already in a treatment program, it might have gotten more or less shut down, or if they were maybe thinking about getting into a program, but nothing was open because we were shut down for the pandemic. So I think it's a combination of probably all those things. I think we did see a dip, a slight reduction a few years ago, where the numbers actually went down some. Let's see if I can find that again. So in 2018, there was actually a small dip in the numbers, and everybody got really encouraged about that. But a lot of the experts sort of speculated that was just because the use of Narcan really shot up a lot. So there were probably the same number of people, overusing their illegal drug, but just a substantial number of them were being saved with Narcan that might have died earlier. So Narcan probably blunted the curve a little bit, but obviously we're being overwhelmed this year, regardless of Narcan.
Thank you. I think those are all the questions I have. Mary, did you have any questions?
I didn't have any other questions. Were there more? I'm sorry. Thank you so much. This is just wonderful information. The league can't say that we will all jump in and be, organizers of things for youth, but
Yeah.
I think we see our job as that education part and letting
Exactly.
people know, the people that
Yes.
we have contacts with, and our contacts have really increased
Yes.
in the last few years. And so putting those groups together is kind of what we see.
Yes.
And we also advocate. I mean, if,
Yeah.
if there was some movement to get the health department and the Fayette County Public Schools interested, we certainly would do, letters, emails,
Yes.
whatever, Facebook posts.
Yeah. Yeah. And yeah, there may come a time when we may need that. We hope that it will be a lot of that will be done more at the personal level.
Right.
But we may need a little nudge from a quality organization outside the health department or the school board to reach out to them. So that we may be talking to you about that.
That sounds great.
Yeah, and and I'm a pediatrician by training, so
Okay, cool.
I fully advocate for this type of thing inherently. But and then, you know, and actually we do have some opportunities for youth to get involved with our we have a voter registration, a democracy team for our high school students. And but you know, of course, it might not be something that kids are, you know, that might not be like as exciting to them as, like, I don't know, playing football or doing dance.
Well, yeah,
But there are some kids that love it.
right. Yeah, one of the folks on my steering committee is a child psychiatrist and feels real strongly that we should have youth representation on the committee because if you're going to do something that affects teenagers, it would behoove everybody to have a teenage voice right there. So yeah, that's a great idea.
Yeah, that is good. That's great. Well, we thank you again, Dr. Dake. This is
Yeah.
just wonderful, and I wish we'd had a huge audience, but it is recorded. We will put it on our website and also our outreach circle, which is another social media device. Good. And yeah, I think we'll probably be making sure that people like Lisa Higgins Hord and Dr. Helm are aware that this recording is there for them to view and find out about this.
Great. Good. Well, great. Well, thank you for your time. Have a good evening.
Thank you for being with us. Good night.
Okay. Good night. Bye-bye.
Bye.